Like any NHS primary care trust, Wandswort PCT in the UK is responsible for managing the provision of local health services and ensuring its population's health needs are being met. The organisation faced a particular challenge when their childhood vaccination rates were falling below national targets. Inefficient and inaccurate reporting systems were found to be hindering the PCT's ability to identify those children most in need, so they turned to Microsoft and their partner 21C to respond with an intelligent IT solution. The result was a powerful business intelligence system that enables speedy access to key information for multidisciplinary stakeholders and an environment for collaborative working to improve immunisation uptake.
In the previous information system, you pushed a button and a report was generated, an aggregate report, and that's what we were using to submit our cover return to the Department of Health. But really what we need to do is have far more confidence and the ability to interrogate the data within that report. What this solution enables us to do is actually generate a list of children and ensure that where they haven't been immunised, we can actually do something about it.
It's the first time we've had all of the information feasibly available for us, so we can look at it all combined, and suddenly we've got information that we can start planning care with, and we're really working out what that means we can do.
Key benefits that we at this stage are deriving are predominantly around quicker reporting, data quality has improved, but also in terms of clinical performance and around uptakes, particularly around children's immunisations. There's been a recognised improvement on the uptake of immunisations.
We can interrogate the data that we have. We can very quickly draw charts and cross-tabulations for different factors that may affect immunisation uptake. Perhaps low birth weight and immunisation uptake, there may be a trend there. Now, if we can identify that the low birth weight babies are likely to be the ones that aren't going to get their immunisation 2 years down the line, we can actually do something about that now. So it's the analytical capability of this system that's exciting, and it's off the back of that that I know that we can do some really positive public health.
The technology underpinning this solution is entirely Microsoft. We start with SQL Server, which provides the database layer. We use integration services to pull together data from many disparate data sources and pull it into SQL. We use analysis services as the engine that really produces the analytic layer. We also use reporting services for general, standard, parameterized in some cases, reports. And we typically use that to enable the organisation to make central returns to the Department of Health.
This solution here at Wandswort is business intelligence made easy. So it takes existing technologies that Wandswort users are already familiar with, such as SharePoint and Office, and allows them to start to crunch through this large volumes of data using Performance Point. So having this data available and then starting to build that collaboration layer on top enables these people to start to network and start to provide information to each other and find answers to problems that might have taken days or weeks otherwise.
What this solution enables us to do is pull together a team that can tackle this particular issue with a shared resource. For example, we can have leaflets, pamphlets and other resources made available to the team members online that they can share. One of the key aspects to improving immunisation uptake in any area is to ensure that the message being delivered by healthcare professionals is consistent. So what this solution enables us to do is to extract from that the key consistent messages that we wanted to deliver to our population.
What we've proven in this project is the Microsoft Business Intelligence platform is capable of solving very specific detailed problems, but also is a very generic solution. And in fact, the solution that we've built for Wandsworth is being adopted by a number of PCTs, that's primary care trusts, the commissioner body within the South West London area. The really nice thing about that is that it's very obvious to them what the business benefits are of this solution. They can also see how this solution is enabling Wandsworth to meet a number of other different problems in relation to maybe screening or monitoring the activity of community workers. And those are the generic problems that the NHS faces all around the country.
Other applications that we feel we in the organisation will benefit from are around world-class commissioning and the ability for the Primary Care Trust to look at the opportunity to benchmark clinical services from different clinical service providers in an easier, more standardised way.
The focus it's tremendous that we can suddenly change from being a very reactive reporting mechanism to one that's really making a huge difference to immunisation uptake.